transplant organs. Hartford Healthcare's transplant team is taking on this issue with technology. Here to tell us more is Dr. Glyn Morgan, Chief of Surgical Transplantation at Hartford Hospital. Doctor, welcome. Thanks for being with us.
Thank you for having me.
Great. So tell us about the research and use of HBV donors in kidney transplant recipients.
Yeah, this is a very exciting innovation. The fact is that, as you know, we're not having enough organ donors across the country to satisfy the need on the recipient list. And so anything we can do to expand the pool of potential donors, including using people who are positive for hepatitis B as potential donors. This has been kind of a long-standing reluctance within the transplant community, and we're trying to break down the barriers and make it more comfortable for our program and hopefully other programs around the country too.
You're right, and there's always such a need for organs and organ donors. So how exactly does this work?
So basically what we do when we put patients on the list, we ensure that they have been vaccinated against hepatitis B, and we check their levels of protective antibody. So as long as the patients on the list have high levels of the protective antibody from their vaccination, then they're eligible to receive organs from donors who are positive for hepatitis B. That provides safety, and the organ function is unimpaired completely. A normal kidney will still be a normal kidney whether or not you have the risk for hepatitis B or not. But we're basically trying to minimize and obviate the risk that the recipients will acquire hepatitis B through organ donation. And so far, we've been very successful.
Okay, and now talk about how this impacts the future of transplantation.
So basically anything that we can do to decrease the discarding of viable organs, anything we can do to increase the organ donor pool is going to benefit the community as a whole here in New England and across the country. And so we're basically trying to set an example that hopefully other programs around the country will follow. The kidneys are good. The organs function remarkably well, just as they always do. We're just trying to expand the donor pool for the recipients that are so badly in need.
And Dr. Morgan, if people want to be organ donors, what's the easiest way for them to do that?
So there's two ways. Obviously, living donation is very, very important. If you know somebody or are aware of anybody who's on a transplant list and you may be a potential living donor, that's the #1 way. We're still very, very positive and promoting this highly. For everybody else, for all of us, frankly, getting your name on an organ donor registry, signing your driver's license, and sharing your decision with people around you that in a circumstance, God forbid, that would necessitate it, people know what your intentions were.
All right, Dr. Glyn Morgan with Hartford Hospital, thank you so much. You always have the very latest for us. We appreciate it.